Good evening. This is Nancy Ramsey. I'm producing my video for my Module 10 assignment. It is a lecture on the maternal health effects on the fetus and the infant. The learning objective for this is to understand the need for a complete health report of the mother at the time of delivery and to understand the effects of maternal health on the fetus. It is also to recognize major fetal and infant complications associated with three major maternal health risks. The learning theory involved here is constructionism. The students have previous experience in respiratory care or within infant care and are seeking the student in this particular case is seeking additional knowledge and training in order to expand their role and their learning. The instructor introduces the student to new ideas and encourages the student to explore and expand their knowledge base, allowing the learner to control what they need to learn. The learning that occurs can often many times be used immediately. This class is a course designed to meet the needs of the respiratory therapist, physician assistant, and nurse practitioner who want to expand their role into neonatology. The lecture covers three major maternal health risks and their effect on the fetus. A case study is based on my experience, and a question is produced to promote student discussion and involvement. For the assessment, there will be a 1 to 2 page paper on something that has sparked the interest of the student, so he can expand on that. There is a reading assignment involved as well. The background on this is maternal health has a direct effect on the fetus. Changes in the maternal nutrition state or circulation, medication, or substance abuse can ultimately affect the function of the fetus, the placenta, and then the fetus, interrupting this efficiency of the mother-fetal interface. Recognizing the risk to the fetus can better prepare the student to care for the infant. The physiology of this is basically fetal health is dependent on the function of the placenta and maternal circulation. The placenta has two functions: to provide nutrients for growth and remove waste, and acts as the respiratory system and provide for the fetus. Changes in maternal circulation changes that blood flow to the placenta, which then alters the nutrient delivery and the oxygen delivery and affects the efficiency of the placenta. The maternal diseases we're going to discuss today are gestational diabetes, obesity, and substance abuse. First is gestational diabetes. 5 to 7% of all pregnancies will develop gestational diabetes. Gestational diabetes is defined as diabetes that first occurs in pregnancy and only in pregnancy. Once the infant is delivered, mother's glucoses go back to their normal state. It is only during pregnancy that this develops. Gestational diabetes requires good control in order to have a good outcome for the fetus. The mechanism we believe that triggers this is this mom is not able to produce a response to the increased strain on her body from the pregnancy. So she cannot produce enough insulin to control her glucoses, or the insulin she produces is ineffective. The mother's hyperglycemia initially leads to fetal hyperglycemia, and then the fetal mounts his own response to that hyperglycemia, and then ultimately may become hyperinsulinemia. the gestational diabetes puts mom at risk for hypertension, preeclampsia, renal disease, and vascular compromise, which can change the blood flow to the placenta, resulting in placental insufficiency. The effect on the fetus and the infant. Hyperglycemia, of course, all that exposure to mom's glucose. The hyperinsulinemia in response to that glucose. Macrosomia is defined as an infant who is in the 90th percentile for weight for age. These babies are very big babies. They're chunky, they're very fat, they have rolls of fats on their little elbows and their knees. This macrosoma can lead to birth trauma because they are so large, especially in the case of a vaginal delivery. The labor may be prolonged, which puts this baby at risk for meconium aspiration syndrome. The delivery may be difficult, leading to shoulder dystocia, which can lead to brachial plexus injury and affects the use of the infant's arm. Growth restriction can occur, again, affecting that placental blood flow and causing placental insufficiency, so the baby doesn't get the nutrients and oxygen he needs and restricts his growth. The same with the asphyxia. Reducing the oxygen delivery can lead to asphyxia. And all these can lead to a premature delivery and the complications that. At birth, the birth trauma is at risk in higher of these infants, and the neonatal hypoglycemia occurs. This baby has been exposed to mom's high glucose level and has mounted his own insulin response. Now suddenly mom's glucose is gone, but his insulin response is still there, so he develops hypoglycemia. And many times these babies need to be treated in a neonatal intensive unit, leading to a longer hospitalization. Polycythemia occurs basically due to hypoxia that occurs for the placental insufficiency. Then the polycythemia leads to jaundice, hyperbilirubinemia, because the liver cannot quite handle all the breakdown of all those RBCs. One unusual thing that people find hard to understand is the respiratory distress syndrome that these babies may have. This mechanism is mainly due to insulin's inhibitory effect on the production of the phospholipids needed for the production of the surfactant. So the baby does not produce enough surfactant in order to have a normal transition into extrauterine life. These babies may require oxygen, nasal CPAP, even intubation and surfactant replacement postnatally. Obesity is the second major maternal disease we're going to talk about. Obesity is becoming an increasing health population in developing countries. We have an obesity epidemic in the United States alone. As in the general population, obesity is increasing in pregnancy as well. Recent studies show that 1 in 5 women seeking prenatal care are obese. Obesity can lead to fetal placental dysfunction. Again, that placental insufficiency comes back. And there also is an increased risk of intrauterine death, and we're not really sure about the mechanism of that. There is an increased risk for birth defects, in particular neural tube defects, and we believe this is due, even though these mothers have a lot of weight and it's mainly fat, their nutrition may not be the greatest, so they may not have the sufficient stores of folic acid to protect the infant from neural tube defects. Macrosomia, again, is a problem because of all of those nutrients it may have. Growth retardation, intrauterine growth retardation can occur in these infants. Again, it can mom's blood flow can be altered, causing placental insufficiency, and premature delivery is also a risk. And our third complication that we're going to discuss is maternal substance abuse. Substance abuse is rising in the general population, therefore it is rising in pregnancy as well. 30% of the women between the ages of 15 and 44 have an addiction. It's estimated that 4.4% of pregnant women have an addiction. The most common drugs are alcohol, tobacco, cocaine, and marijuana. This is the most preventable complication of pregnancy. So I have a question for you. With substance abuse on the rise in the general population in pregnancy, of the 4 commonly used substances of abuse, which do you think has the greatest effect on low birth weight infants? This question is designed to engage a student in a conversation and discussion about substance abuse and its effect on mom and the baby. It's being used to encourage some critical thinking on the student as well. Maternal substance abuse, again, small for gestational age, prematurity. This can all be related to the poor nutrition these women may have. Fetal alcohol spectrum disorder. This has been one of the first recognized fetal complications due to the substance abuse, and one of the most studied, and continues to be one of the most studied. Low birth weight, withdrawal symptoms, SIDS, sudden infant death syndrome. These babies are at a higher risk for SIDS. Congenital anomalies are also a risk, especially in heavy users of the drugs. Neonatal abstinence syndrome occurs particularly in the opiates that are out there in cocaine. These children will have withdrawal symptoms. And failure to thrive. These children are just very poor eaters in general. And it also may be to the fact that mom continues to use drugs after delivery and may not provide the child with the needed nutrition he needs. Legal drugs, tobacco. Mainly it's the nicotine within the tobacco that we're concerned about. 16.4% of women smoke during pregnancy. Nicotine is but one of 4,000 compounds found in cigarette smoke that can cause complications to both the fetus and the mother. It is the worst for a low birth weight. And heavy smokers early in pregnancy can change brain development. And again, there is a small association with oral facial anomalies, especially with those heavy smokers. Alcohol. 10.8% of women use alcohol during their pregnancy. Alcohol crosses the placenta and the blood-brain barrier. It is toxic to the placenta. Heavy alcohol use can cause congenital anomalies as seen in fetal alcohol syndrome. And it can cause low birth weight and small for gestational age. Cocaine. Self-reporting surveys say that cocaine is on the downside, but is still the third largest use of substance abuse. It has a teratogenic effect, especially early in pregnancy, because again, it does cross the brain-blood barrier. It affects the neurotransmitters. It can change brain structure, and these changes to the CNS are permanent. And post-delivery, they can have withdrawal and develop neonatal abstinence syndrome. Marijuana, on the other hand, has no teratogenic effects. It does not affect weight of the infant. However, it does have a 30-day half-life, so it has a very long exposure to the infant, so it has more effect on the neurotransmitters because of this prolonged exposure. It has 5 times more carbon monoxide than tobacco smoke, which can lead to intermittent hypoxia to the infant, causing more complications and this is a case study based on my experiences. It's probably a combination of several deliveries that I attended. Again, this is to involve the student in the discussion and in the learning process. It helps to promote critical thinking. It helps them start to connect things. This is the conclusion of my video assignment for Module 10, and thank you for listening.